Well, in 2014, the federal government of Nigeria signed into law what was initially known as a National Health Bill into law. It became the National Health Act. And that National Health Act is a compendium of the implementation and guidelines that guides the implementation of the health sector in Nigeria. Section 11 of that act made provision for at least 1% consolidated revenue of the federal government to be used to take care of the minimum basic services that people require in communities. And that is what is called the Basic Healthcare Provision Fund in that section. This fund goes to the three major gateways: the primary healthcare development, the health insurance gateway, and the emergency medical treatment gateway. So what we are implementing is the 50% that comes to the health insurance gateway that is meant to provide financial risk protection from the demand side financing for the vulnerable population. In Imo here, with the directive of His Excellency Distinguished Senator Uzodimma, we ensured that only the vulnerable population got enrolled into the Basic Healthcare Provision Fund. And that explains why across the country we have the highest level of utilization, because we actually enrolled the needed population that needs these services.
And that's the next question I was going to ask. How, were you able to implement differently, right? How were you able to get people to start utilizing this as opposed to what we've seen in the past?
Yeah, what we did first is to enable people know who should benefit from this Basic Healthcare Provision Fund, because the fund is not enough to cater for everybody. So we ensured that only the vulnerable population got enrolled. It was quite a Herculean task for us, because to segregate this population, you may not know exactly who is poor, who is vulnerable, and all that. But we concentrated on children under 5, pregnant women, people who in terms of socioeconomic status, they will not be able to access health services in the event of need, and the elderly population. So those are the population we concentrated on. And we use the officers in charge in the different health centers to do this enrollment with our staff on ground to do the validation of this population. So we got reasonably a very appreciable number of this population in our database.
Interesting. So, but I'm very interested in the how. Was it the traditional media? How did you communicate with these people? Was it who did you use? Was it their people that you used to communicate with them? How did you do that?
First, we had communication with the OICs, who also helped us to discuss with the gatekeepers of the various local communities, the AZEs, the IGWEs, and the President Generals of different town units. And also the Imo State government, local government liaison officers, local government chairmen, they all helped us to enlighten people to get themselves enrolled into the Basic Healthcare Provision Fund.